Welcome to Vigorous Health. I'm Coach Steve, and today I'm joined with Dr. Steven Devos from Belgium. He's an actual dermatologist, so I asked him to be on the show and discuss acne and everything that's related to acne. So, Dr. Steven, I know you have a channel called The Lifting Dermatologist, as well as a TRT and hormone optimization channel. Can you talk to us a little bit about those two YouTube channels that you have?
Yeah, sure. Thanks for having me, Steve. A few years ago, because my whole muscular is easy. I trained for 3 decades already. But how do you become lean? And they ask me, well, I have a belly here. So what can I do to lean down? So I thought, how can't you know how to lean down? You eat less and you work out more or whatever. So I started to write pages. So I looked for an editor, and so I have this book called Flexible Dieting and Resistance Training.
Right.
So, and the editor told me, why don't you start a YouTube channel? Because then you can interact with people. And it was actually the editor's idea. So I started this channel, The Lifting Dermatologist, about weight training, dieting, supplements, and so on. But because I showed myself in 2017 all signs of hypogonadism, low T, actually at my age of 42, 43 then, I searched a doctor for TRT, but I couldn't find any that had any experience here in Belgium. So I went to search, typical. So I went to search online, and as a doctor, I reached some other doctors, especially in the United States. And they wanted to do interviews with me, and they wanted to bring out the word about TRT and hormone optimization into the world of YouTube. So I said, I already have a channel, but I'll make a new one all about TRT and hormone optimization. So on that channel, I have podcasts like this with experts. I'm not an expert into TRT. I'm just a weightlifting dermatologist. So I have these two channels, Steve.
Right. So we already did a few interviews together in some of your channels, which I think were very well received so far. So what I've seen. So I figured I wanted to get an expert on dermatology and acne on my channel and discuss acne, because I get so many questions on a daily basis on how to control acne, what you can do to mitigate some of the side effects, and especially in relation to steroids, because acne is one of the more common side effects of steroids, besides gynecomastia and water retention. So let's discuss hormone balance first. Whether that's for a drug-free, just a normal natural person, or an enhanced person, which of the hormones do you feel that contribute to acne formation?
Well, actually, all the sex hormones especially have a big influence on acne and sebum production. That is in males and in females, especially in naturals as well. So I always talk about females as an example, because as being a natural, women have the most fluctuations during their life. Of course, boys and girls have their puberty when acne starts, but then girls have these monthly cycles of menstruation and so on. They also see acne around that cycle every month with their periods. They have anti-conception pills, they have pregnancies, and they have the menopause. So all these moments in life for women are moments of fluctuations, especially fluctuations of sex hormones for them. Tend to give a bit acne, and those that are, of course, prone to it, not everyone. But the same goes for men, the puberty, and when they go into menopause or hypogonadism, it's more a gradual process, of course. But when you get on TRT, like me, for example, that's, again, fluctuation of sex hormones, and that can give some, acne problems as well. But of course, you're talking about PEDs, so anabolic steroids, and that's the same thing, but in supraphysiological doses, so that can be more exaggerated.
So do you think then, is it, when it comes to the sex hormones, do you think it's the imbalance that is causing the acne, or just one of them being super high? Like, for example, estrogen is very high and it causes acne, or DHT is very high and it's causing acne, or is it more so the imbalance and the fluctuations between all the different sex hormones?
It's especially imbalances and especially changes in sex hormones. Any change can give it. And one is more prone to the one kind of change than the other. Again, for example, women, they can be good with their anti-conceptive pill, a young girl, and then when she's 25, for example, she stops it because she wants to get pregnant. And the
Hmm.
moment she stops this pill, she gets this acne. But
Right.
with the months that pass, the acne goes away. And then the moment she's pregnant, for example, again, acne. But it can be just the inverse as well. So
Yeah.
it's really the change. So, and some women find that very difficult to understand. So they change an anticonceptive pill from one brand to the other, and they
Right.
get acne. And they say,
Right.
well, this new one is bad. I'll change again to another one.
And then
And with
get
every
acne.
change, they extend their acne problems because they have these imbalances all the time. So I always
Hmm.
say, give it a few months. If it calms down, stay on that kind of anticonceptive pill. But of course, in men using PEDs, this always goes into cycles on and off, and there's always imbalances. So yeah, it's really the change in sex hormones that drives imbalances, and not one thing that is very supraphysiological. But of course, being supraphysiological exaggerates all the signs of acne.
So basically, there's no way around it when you're on cycle. Even, well, if you keep everything super stable, even by the fact that your super physiological dosages of testosterone and perhaps, letting estrogen climb and all the other hormones alongside of it, if you're prone to acne, you're probably just going to get it. And and sebum production is, of course, accelerated by any of these hormones, whether that's
Mhm.
testosterone, estrogen, DHT. So by going on cycle, by definition, you're going to get more acne production. Right.
If
So,
you're prone to it, you're
yeah,
going to get more oily skin anyway.
right. Yeah.
So if you're prone to it, you're going to get it. Yeah.
Right. Yeah. I'm very prone to it. So I'm 36 now, and I've had acne all my life, and I've done, a million different things to try to mitigate it. But even when I take, medication and pay 100% of my diet, whenever I'm on cycle, I get acne. And I have to use like Accutane to control it. So we can talk about Accutane a little bit later. So I know the popular medication for women is spironolactone, aldactone, which is an anti-androgenic hormone. And men use it for contest prep because, they want to get lean, and it downregulates the aldosterone levels. So it's easier to secrete sodium in water. So is that a common prescription for women, the aldactone or the spironolactone, and what are the results based on the long term? Is that a useful medication for women in regards to acne formation?
Yeah, it's used especially in young girls that are prone to acne. They have these
Hmm.
anti-conceptive pills that
Yeah.
contain a little bit of this anti-androgen,
All
but
right.
it's
Okay.
it's not good for it gives other side effects for them, like
Yeah.
it can cause all kinds of pain during the menstruation. Their
Right.
breast can hurt, so they can have other side effects. So a lot of women try it out. It's better for the acne, but
Hmm.
when they come to a dermatologist, I'll recommend against it, and I'll switch them to an not hormonal anticonceptive like copper,
Yeah.
the intrauterine copper device,
Right,
and
the
I'll put them
Paragard.
on,
Yeah.
Accutane or minocycline or whatever oral antibiotic. Yeah.
Yeah, right. So my wife, for example, she competes. So we never wanted to use a birth control, the normal estrogen and progesterone birth control. And she also has acne, but that was not the main reason. It was mainly because, estrogen has, some fat storage properties. And whenever she was competing, you're trying to get lean, and then you're sending another signal, trying to store body fat by taking, birth control. So we switched her to a copper IUD, a
Hmm.
Paragard IUD, and she was able to get lean, and then her acne actually reduced,
Hmm.
because even though she never took birth control, her acne reduced by switching to a Paragard with a copper IUD, just to make sure that her period was more stable. And the weird thing is, her period got heavier, which is a side effect of these Paragard copper IUDs, but they're still better than the hormonal IUDs. So
Yeah.
that was a very noticeable. So that's, it's not very beneficial for men, but for women, it's very, very beneficial. And I tell all my female clients to get a copper IUD over a, birth control or a hormonal one, simply
Yeah.
because of the acne benefits, and the possibility to get lean for the competition stages. So that,
Yeah.
that basically,
I recommend for the women. Yeah.
yeah. So that basically covers it for all the hormones. I guess the conclusion is just any high dose or fluctuation is going to contribute to acne. Are they?
Exactly.
Did you ever see any special cases, like, for example, a bodybuilder came in and he is covered in cystic acne, is it when you ask them about their hormone use? Of course, they're going to lie, but if they're if they're honest about it, is there any special compound that they mention that you hear frequently, like trembolone or nandrolone or primobolan? Which one do you hear frequently if they're open about it, or are they not?
Well, the funny thing is, Steve, I see a lot of young bodybuilders coming in, and they are 19, 20 years old, and they're double my size. So, yeah, and they say, well, yeah, you look like you work out too. I say, okay, you're double my size, you're 19 years old, so what are you taking? And because they look at my physique and they say, well, I can tell you, I can trust you, I see that.
Right.
So, but the funny thing is, Steve, they don't know what they're taking. Most of them,
Oh, wow.
I ask, what are you taking? They say, I don't know. I get an injection from my coach twice a week.
Yeah.
And that's
this is very common. This is very common. And I remember in Holland was the same thing. The coaches don't even tell them, and of course the coach is also the provider. Yeah. And it's 2 injections of this and that. And it's very difficult. And a lot of people have no idea, what they're taking or what they're doing, and then, the potency and the purity of the compounds. And that probably exacerbates the whole situation.
Yeah.
If you don't know.
I've had some that could tell me I'm on 500 tests and 400 deca, things like that. Mm-hmm. It's almost always high doses of test. Well, I don't know if you think 500 a week is a high dose of test.
Oh, it depends on your goals.
Combined with different other compounds like deca, especially, I hear can give a lot of acne as well.
Yeah.
I've seen with cystic acne from deca that are really spectacular.
Oh, wow. Spectacular acne. Something you definitely don't want. Yeah. So I noticed the worst for me, for example, whenever I would use trembolone or nandrolone, I would get the worst acne. Mm-hmm. And whether that's, due to prolactin increases or potential for increases in estrogen levels, I'm not really sure. But those 19 more compounds, they were the worst on acne formation for me. So I stopped using those a long, long time ago, and limit myself to FDA approved compounds. So that's pretty much the hormone situation out of the way. So what are some of the supplements we can use to mitigate acne formation? Something like a vitamin B5, for example, or evening primrose oil. Which supplements do you feel actually work when it comes to acne?
Well, there are 5 that could work, but of course, when they come in a practice to see a dermatologist, they're not really interested in just over-the-counter supplements.
Yeah.
We've already tried that probably,
right.
As well the bodybuilders as the regular patients. They want a medication if it's topical or systemic. But the things that work indeed, Steve, are vitamin B5 or pantothenic acid, because it decreases the oil production. So that's always comes in handy for oily skin. Yeah. So the recommended doses are there 3 times a day, 750 milligrams. So vitamin E is also a thing.
Okay.
But doses are very very difficult to find the right dose, because high dose long term could give side effects as well.
That's true.
So
that's
I recommend 400 IUs a day.
So about 300 milligrams or 400 IU of vitamin E for skin health. And I think the vitamin E mostly works through the antioxidant properties that it has. And of course, it promotes a little bit of, skin healing and that kind of stuff. So it's always a good supplement to take. The vitamin B5, in my experience, like 20 years ago, like a long, long time ago. So I was reading about acne. I didn't know about Accutane, and I read about pantothenic acid, vitamin B5. And on the internet, they said you have to megadose it, very high amounts. So I ended up taking 20 grams per day. Yeah, but it worked. It worked really, really well. Yeah, it worked really, really well until you realize you're losing all the other B vitamins. Because they all go through the same pathways. So I had to supplement in order to feel normal and for energy production and energy levels. I had to supplement 3 tablets of B100 complex. I'm not recommending anybody to do this, but it did work. So it's 20 grams of vitamin B5 and then 3 tablets of B100 complex just to replenish B vitamins that you're losing, because that's a common side effect of these B vitamins, because they all detox and metabolize through similar pathways. So if you're megadosing one, it's similar as your hormone ratios are being off. You're megadosing one, and now everything is out of your system. So for the people that are considering trying that, please take a B100 complex formula alongside the megadosing of pantotonic acid, just to prevent depletion of those micronutrients. And gammalinoic acid from evening primrose oil. Did you ever notice that has a benefit?
I never tried it, but I've had some patients that told me they try it. It contains omega-6 polyunsaturated fatty acids. So these are also anti-inflammatory. So that could help treat or prevent acne at least.
Right.
What I also prescribe or recommend is zinc for a lot of patients.
Yeah.
So
okay.
That can help as well for the immunity, because we also give it to children that wants to fight off warts, for example, the papilloma virus. So I give it in the dermatology for warts, but if you give it to young adolescents, it helps for their acne as well, if it's not too bad, of course. Right. So that's 20, 30 milligrams a day.
Oh, that's it? Only 20, 30? Because I remember everybody's like, oh, zinc, I need to take 100 milligrams for the testosterone boosting effect, right?
Yeah, well, now that's true. You can't go over 50 milligrams. So
that's a 30, 40, 50 milligrams is more than enough. Yeah.
Yeah, it's more than enough. Yeah.
And any other over-the-counter supplementations that could possibly be helpful?
One more, the classical L-carnitine.
Really?
Yeah, an amino acid that also can help enhance the metabolism of fats and oils.
Right.
So it can help for the oil production as well. So that's 3 times 250 milligrams a day. So, but that's a lot of fitness people and bodybuilders take already. So.
Yeah, we take that for fat loss, obviously, and it helps with androgen receptor sensitivity or density on the cell membrane. So you get more androgen receptors because carnitine contributes to androgen receptors. So most guys in the bodybuilding industry, they already take like 2,000 milligrams of carnitine per day. So let's say an over-the-counter supplement stack would be around 3,000 milligrams of vitamin B5, 2,000 milligrams of carnitine, 30, 40, 50 milligrams of zinc, and then perhaps 2,600 milligrams of evening primrose oil. Okay, so that's basically what I'm running, but I'm still getting acne. I'm still, right. So
don't expect too much from that.
No, right. So it will contribute, of course, to nice skin, but it's not going to be the end all and be all acne cure, especially when you're using steroids, which you try to get your acne down, but you're taking something that's going to bring your acne up. And I think the steroids are going to win in that sense. So I think the last part that we can discuss is the medication. Which medications are generally prescribed for people suffering from acne? And I'll try to please differentiate between normal acne that's kind of manageable with maybe topical formulations, or cystic acne, which is of course very severe acne. That is more deeper in the skin. So which medications do you think are applicable in both situations?
Well, a lot of people, even that come to a dermatological practice, have already had some topical application products over the counter from the pharmacy or via their GP, their general practitioner. So topical things that could help, especially in adolescents with acne that's not too bad, is, for example, benzoyl peroxide. That's over the counter. That's drying out your skin a lot, but also discolors your clothes, your towels, and so on. So that's not too nice of a product to use daily, because it can destroy your favorite T-shirt or whatever. So I don't prescribe that.
No, right.
But you also have topical antibiotics like erythromycin, for example. Accutane, or what they call in Europe Roaccutane, that's actually isotretinoin. So you have a local product, topical, is called tretinoin. So tretinoin, it's on prescription, for example, it's called adapalene or differin cream.
Okay.
So these dry out the pores, the skins, the papules, the pustules as well. Okay. So tretinoin, we can have it compounded by the pharmacy as well. Prescription tretinoin. It's also anti-aging, so I even prescribe it for older ladies for the sagging.
So I've heard about these creams, but I never was able to use it. So it has some anti-aging properties. Okay, And then is that combined with vitamin E? Because usually some of the skin creams also contain vitamin E and aloe vera and that kind of stuff. So are there combination formulas of that available?
You can have it this formula, aloe vera, for example, that's anti-inflammatory, and it contains tretinoin. It can go from 0.010 to 0.050%. In the beginning, you should start low because it can also irritate the skin in the beginning. So you should build that up.
Okay, so it's a slow, gradual process. And how do those topical applications compare to the actual medication of Accutane, which of course are prescribed between 10 milligrams per day up to 80 milligrams per day?
Well, as soon as a dermatologist sees scarring, so pitting or really big scars from manipulating and so on, we tend to prescribe systemic medication, and that's or oral antibiotics or this isotretinoin or Accutane. So oral antibiotics, I explain to the patients, are always temporary. So you give them, it's better. You stop them, it starts all over. So even if you take oral antibiotics for years on end, if you stop them, you're at the same.
Because the biotics slowly repopulate your skin. So I always felt that it was a temporary thing. So for example, what I tried was 2 weeks of doxycycline, which is just a broad spectrum antibiotic. And within 2 weeks, you notice some improvements on your skin, but then you usually have to combine it with Accutane or some of the over-the-counter supplements to improve it even further. But I think it's a valid approach just to kind of calm everything down if you have cystic acne. So let's say cystic acne is formed from biotics and things that are growing inside the sebaceous gland. Then the doxycycline or the antibiotics are kind of killing off the bacteria that are causing the cystic acne, and then you heal it from the inside out with Accutane or some of the over-the-counter supplements. So I always felt that it was a temporary thing. So which antibiotics are generally prescribed? It's doxycycline, clindamycin.
Yes, it's all family, one from each other, especially the cycline. So you have minocycline, you have the doxycycline, and what is very commonly prescribed here, tetracycline brand name. So that's the most popular one because it doesn't give this light sensitivity like doxycycline or minocycline does. When you take them and you go to the sun, you burn more easily with doxy and minocycline.
Yeah, that's correct. Yeah, it makes you very photosensitive. So with tetracycline, you don't get that as a side effect.
Yeah, tetracycline should be better.
Yeah, it should be better, right? Right.
Not 100%.
But it's not a good idea.
That was the commercial when they started out. Use our product because it makes you less light sensitive.
But I'm sure if you go tanning to the tanning salon, you will still get some side effects on tetracycline. Yeah. Right. So on the subject of tanning, does it work against acne? Quick intermediate?
It does work in the short term, but if you're really tanning a long time, your skin as a defense forms a thicker skin barrier. So your skin becomes thicker during summertime, for example. And by the end of the summer, you get your acne back because when your skin gets thicker, the pores get longer and they get more blocked more easily. So especially here in Europe, we always say now, September, October, that's the acne period for us because after summer, all the adolescents, they were better in June, July because of the sun, the initial tanning. But then in September, October, all the acne and the patients come back in. So
well, that's I never, but it makes a lot of sense because I remember when I was younger, I would go tanning all summer, right? And then in September, October, it would all come back, and sometimes even worse. But maybe it's because you start to wear the clothes, and it's a little bit easier to eat greasy food. And you cover the skin, and you're feeding the bacteria with or the sebaceous production with bad dietary choices. So let's get back to the Accutane because that's at one point people are going to resort to that anyway. What are the the general prescribed dosages for Accutane, and at what point, which dosages do people usually see side effects?
Well, the good thing with Accutane or isotretinoin is that it gives a cumulative effect. So the more you take, the longer you take it, it's cumulative. So it always gets better and better. And even if you stop, it's not temporary, but it gets really healed from the inside out, like you said. Really heals the sebaceous glands. It teaches them to calm down, not to produce any more sebum, that then clogs the pores and gets infected and inflamed by the bacteria.
Right.
So it's really the root cause that is treated with Accutane. So the general doses needed to have your end goal of healing is 120 to 150 milligrams per kilo body weight. So that's the total you should take. If you weigh 80 kilos, for example, I'll start you up at 30, 40 milligrams, and that's manageable.
Yeah.
You'll get dry lips for sure, a bit of dry skin, but not too bad. And yeah, that's manageable. Most people will just hydrate the skin a bit,
Right.
a kind of balsam on the lips, and
Right.
they'll be good. So I'll see them back after 2 months. I'll ask how you're going. Is the acne getting better? Is the skin not too dry? Do your joints don't ache, your muscles, because it can give muscle pain as well, especially if you work out hard. I see a lot of professional basket. You put them on Accutane, they will always complain about these muscle aches after training.
Yeah, of course. Yeah, because you're drying out the joints and the tendons a little bit as well. So let's say a bodybuilder of 110 kilos comes in and he's on testosterone and nandrolone. What would be the recommended Accutane protocol just to get this guy back to having a clear and healthy skin? So it's 110 kilos on steroids.
Well, you start on 50 milligram.
Okay.
Look how that goes. Half because it's per 10 here. So you start half of the body weight, and you see them back after 2 months. It should start going better. If it does, and the side effects are manageable, then you can go a little bit higher. You go to 60 or 70 milligrams a day. Wow. The more you take per day, the sooner you will get by the end of 120, 150 milligrams per kilo of body weight. Yeah. So usually that can take up 6 to 8 months, maybe a year maximum.
Yeah, and then usually by the time, is there a tapering protocol? So let's say that all the side effects, all the acne is gone. Is there a tapering protocol that needs to take place, or you just stop cold turkey?
Yeah, we can stop cold turkey.
Cold turkey, okay. And so people notice that their liver enzymes go up a little bit. Generally, does it involve blood work to check the liver function and tell the patient that, hey, okay, no alcohol, no drugs, no oral steroids, especially if
in the regular patients, that's not into fitness, bodybuilding, or PEDs whatsoever. We do a blood control up front, just to have a baseline, and then maybe after 2 months, 3 months, just to check. But a normal adolescent, 17, 18 years old, that's not on PEDs, you don't expect any problems. And even if you see an elevation of liver enzymes, it's not too high, and it's always temporary. When you stop after 6 months, it gets back down. That's only temporary. So if they are worried about that, I always explain to them, why are you even worried? If you drink a couple of glasses of alcohol each weekend, I guess you're not worried about that either. No. So don't worry, this thing is here to help you. So just, I just control it once, and then we stop talking about it. But in the PED using bodybuilder, of course, I guess if you take a baseline blood examination and you already have elevated liver enzymes, that's a bit tricky, of course. That's always a trade-off. Want to take extra for
do bodybuilders get rejected? So let's say their liver enzymes are 80 to 100 units per liter on both liver enzymes, and but their gamma GT is in range, their bilirubin, other liver enzymes are in range, or liver markers are in range, except the liver enzymes are elevated. Will they get rejected, or at least in your practice or within the restrictions of Belgium? Because I'm sure medical field is going to be different everywhere. So if their liver enzymes are 100 units per liter, they won't get rejected for the treatment.
It's definitely the call of the doctor, not of the laboratory. So I speak with the patients about their results. So I put it in their file. I discussed it with them. I explained, how high this elevation is. If it's only double, if it's 3 times the normal ranges, it depends. So
Mhm.
Yeah, it depends how much Accutane you want to give a day as well. Eh?
Yeah, of course. Yeah, of course, of course, of course. Yeah, yeah, yeah.
It's
So
really,
the
really high elevated baseline. Maybe we start lowish.
yeah, of course, yeah, yeah, or tell the patient to get their health markers in range first because it does take. I mean, it does put some pressure on the liver, obviously. Otherwise, it will be available over the counter. This medication comes with a little bit of side effects. So the common recommended dose is 50 milligrams per day, or half the body weight, basically.
Of body weight.
So
Yeah.
what I'm doing is an extremely low dose of 10 milligrams 3 times per week. And that's something to, with the supplementation and the dietary choices and the limited on choices of performance enhancers, 10 milligrams on Monday, Wednesday, Friday is enough to keep my acne at bay. But I feel it's not solving the issue. It
Well,
just,
it will take ages, of course, to have this cumulative effect. It will take
right.
ages.
So
So
I've been doing this for,
if you weigh 100 kilos and you want 150 milligrams per kilogram, so you can just you take only 30 milligrams a week. That will take
yeah.
ages.
So it's basically just preventing the formation, but it will never solve it, what I'm doing. Yeah.
Yeah, at that rate,
Yeah.
it will just prevent it. Yeah.
Right. So, on one side, I'm putting the least amount of extra pressure on my liver and my system, right? My joints feel okay. My liver enzymes are acceptable. So in that sense, I'm not putting too much pressure, but I'll probably have to run that protocol for life because the cumulative effect is not enough for me to actually solve it.
Maybe one day when you completely come off PEDs, then you can go higher, but maybe you won't need it anymore at that moment.
I'm getting a little bit nervous now. No, yeah. At one point, we'll all have to come off, right, or at least reduce to true hormone replacement. Right. Yeah, I've always been considering to do a high dose Accutane, maybe 50 milligrams per day, but I've always been a little bit hesitant. But I might have to do that in the future because after 5 years of 10 milligrams of Accutane 3 times a week, I get the same amount of acne that I do, like a pimple here, a pimple there. If I eat bad chocolate, it's worse. But it's been consistently managed, but it's not improving, and I still get a little bit greasy skin. So, all right, so I have to keep that into consideration. Before we forget, I'd like to touch on diet a little bit. Um, Dairy products, how much do they contribute to acne?
So dairy products are the most suspicious thing in the food that could cause acne, but I have the impression that it's not in a big part of the acne population. A lot of patients that come to me say, I have already tried not to eat dairy for 6 months, 3 months maybe, that didn't change anything for me. So for some it does, but in most people it does not. And the same goes for sugar, processed
Mhm.
foods. I hear you mention chocolate
Yeah.
in Belgium, very popular. So a lot of people try to avoid that as well. They try it out, but lot of times I hear them say that doesn't change much for me.
Okay. So a lot of people, they don't notice that much difference by making dietary choices. Do you
In a few
feel
it does, but in most it does not.
okay? Do you feel there's any other food choices that are like always contributing to acne, or is it very individual?
My professor at the university said it's all a myth about the food and the acne, and especially in Belgium, it's the things we like most here, like the chocolate and the fries, the French fries,
Right.
that are the most suspicious. But that's all a myth, he says, because if you ask anyone what's causing the acne, it must be the thing that we like the most. So that's why the chocolate and the French
uh,
fries are the most
yeah.
suspicious. But there's not much to it.
Okay, okay. Well, that's good to know. Because I do recommend people to get off dairy products, especially in the hence bodybuilding community, because I do feel, from what I've seen with my clients, is when I recommended to stock dairy products, the acne gets better. But these are all guys that are running, performance enhancing drugs, and sometimes significant amount of performance enhancing drugs. So I do notice a little bit of a difference, but it could also be because they cut out the whey protein, which has some lactose and it's processed, and they're more mindful of what they're eating. Because a lot of guys are like, oh, I'm not eating dairy products, but they still eat pizza. You never really know how much it contributes, but I always felt that it was one of the contributing factors. But I guess it's not as contributory as I thought it was. do you sometimes refer people to a dietitian, or is it just, acne medication when they have systemic acne?
Well, if the patient himself is really suspicious of anything in the food that is causing it, because you have patients that never stop to go on about it. They say, well, it must be this in my food. I've tried that. I can't find it. Then I recommend to do an elimination diet. So then I send them to a dietitian. Yeah.
Yeah. Okay.
But, only then, in most cases, yeah, if they're in my office, they're there to be treated. So.
Yeah, of course. Yeah, and they've already made up their mind that they, want to go the medication route. Are there any, the last question for you today is, are there any medications on the horizon that are maybe, being researched right now or in clinical trials that have promise for acne treatment in the future? Or is Accutane basically the last and the final destination in acne formation?
I'm afraid so. Nothing has been presented to me because the representatives of many firms come into my office regularly with new stuff, but it's not for acne. It's a lot for psoriasis, for atopic eczema, for hives or urticaria even. But for acne, there's not a lot of new stuff coming really.
Okay.
But the Accutane, the isotretinoin, has really been very strong. It has been with us since 1985, so it's already 35 years. So it has proven to work. It's safe if you don't exaggerate with the doses and if you do blood work. So all dermatologists are happy with it.
Okay, well, that's good to know. Yeah, I've used it myself, and I'm very happy with the results. But it's good to know that it has a cumulative effect, and that basically, if you really want to cure the acne, you'll have to run at a shorter period at a higher dose, just to calm the sebaceous glands down a little bit, and reduce the sebum production and the potential for acne formation. Okay, well, I think that pretty much sums it up. Thank you so much for all your information. I think this is very, very valuable for all my audience and the bodybuilding community, because acne is one of the things that everybody struggles with nowadays. So thank you so much. I would advise everybody to subscribe to Dr. Steven Devos' two YouTube channels, the Lifting Dermatologist and the TRT Hormone Optimization channel. I'll link those down in the bottom. Any final words for my audience?
Well, I'm following your channel as well, Steve. I've learned a ton about PEDs, not that I'm using them, but it's always interesting to know more because my clients, my patients are talking about it sometimes. And I've learned from you what they're talking about. So thank you so much for your input as well. So it was my pleasure, Steve. It's my daily job next to lifting as a hobby. So my pleasure.
Thank you. Thank you very much. Highly appreciate it.